Good morning, and welcome back to another segment of Preserve HealthTalks. And this morning we have with us a very special guest because I've known Dr. Talton for years. Dr. Leighan Talton from Whole Life Direct Primary Care. Welcome to our show.
Thank you for having me.
This is going to be a lot of fun. And this is Leah.
Hey, Leah.
Hi.
Yeah, Leah's my co-host on the show and nurse practitioner in our group, Preserve Health, MD. And Leanne and I, Dr. Talton, we do similar things. So I thought this morning we would talk about what we do and kind of why we do it, some of the trials and tribulations that we have doing it. So in the next 15 minutes, we'll go through a whole bunch of stuff. So let's get started. So what originally drew you to concierge medicine, and how did that experience, or your experience in particular in traditional medicine, kind of shape the practice that you have now?
Well, don't I have you to thank for me being in concierge medicine?
Yeah, well, flattery is everything, so I
Yeah,
appreciate
no, yeah.
that, yeah.
So I was probably 5 years into a traditional medicine practice, and the opportunity arose for me to start my own practice, and that's when I met you. And you helped me get started in concierge medicine, and it's been a dream ever since. And
Thank you.
yeah, and basically it's everything that I loved about regular non-concierge medicine practice, but all the highlights, everything that's great about medicine, everything that drew me to medicine is what I get to do in concierge medicine.
And you really wanted to do this because we got you set up really quickly, like in
Yeah.
2-3 months.
3 months.
Yeah, 3
Yeah,
months. You
3
were
months.
you were rocking and rolling.
Exactly.
Yeah.
Yeah.
Have you ever regretted going into concierge medicine?
No, not at all. I did take some of my patients with me from the old model to the new model, and the old model was what was lacking, right? Like, it was broken from the get-go because you can't do this job in a 15-minute visit well. And so when I transitioned over to concierge medicine, where I actually had the time and staff support to do what I'm supposed to do, that was when it felt right. It didn't feel right before then.
And many patients don't understand what concierge practice is, or they don't know anything about it. So how would you explain it to them, and how does it compare to the traditional model?
So concierge medicine, I think of it as, it has two definitions. So the real definition is that it's a financial model that says that patients pay a fee to the physician, who also bills insurance for their care. But what we do is probably what the patients think of as the definition of concierge medicine, which is they do not use their insurance to pay for their visits. They pay, cash for their visits, and the model is what we define as concierge medicine these days, is a more personalized, smaller practice where, because we're not bound by that face-to-face encounter that we bill Medicare for, we can craft the visit to be whatever we want, which for myself is usually an hour long. And it means that we're able to have fewer patients in the practice, so each person gets significantly, I think I had almost 2,000 patients in my previous practice, and so 1/10 of the patients that I had before equals way more attention for each of them, and I think they feel that with every interaction that they have with the office.
Nice. So there are a lot of different types of patients that join concierge practices, but just from your perspective, what types of patients join your practice? So why would I, as a patient, want to leave a traditional model and see you?
So I say to patients, prospective patients who call, that in the olden days it used to be people who were fancy or had higher medical needs is the only patients who would pursue this type of practice. But nowadays I feel like what all of the patients have in common is they have a requirement for better care from their physician. So they have typically been used and abused by the traditional model. That's unacceptable to them, and they want to have a deeper, more personal relationship with a practice who knows who they are.
Exactly. And I think it's better access to care. Most of my patients will say it is so comforting to know that you and Leah are around when I need you, and I can call you anytime. And in my old group, where I was seeing a doctor over there, I couldn't even get through on the phone, much less get in to see anyone for 6 to 8 weeks.
Right. Right. And I think that it's not just me that they have access to, it's myself, my staff, and that makes a difference too. I mean, when you call an office and you know who's going to answer the phone and you already know, how long it's going to take for a message to get to me and what to expect, all of that feels very comfortable. And most patients, even my patients that are still, which they all are, in the traditional world for their specialty care and everything else, that doesn't happen at other offices. In fact, they ask me to call on their behalf a lot to get a hold of real people and not answering machines or button pushing to get a hold of people to get their needs met. So it's the practice, not just me, that's different.
So before Leah asks her next question, I know a lot of you are thinking, wow, her voice sounds so familiar. Okay, so if you're on my website, Preserve Health MD, and you go to the blog page, you're going to hear Dr. Talton's voice, because we used to be co-hosts of a radio show together. It was so fun.
I'm the OG.
You are.
I'm the OG co-host.
You are.
He
You are.
upgraded with Leah.
So we had the show Paradox.
Yeah,
And it was
fun.
so fun.
It was so
Yeah,
fun.
we enjoyed that.
Yeah.
Yeah, awesome. Can you walk us through a typical day in the office? What type of patients do you see? How many patients are you seeing?
So I am the drop off and pickup person for my kids. I have 4 kids. So I drop some of my kids off at school. I'm in the office usually about 8:30. We come into a few emails usually that came in overnight, medication refills, stuff I needed to do from the day before. I usually see my first patient around 9, and most days are 1 patient per hour. I do see patients over lunch for acute visits, or she'll put 2 acute visits, within an hour, but most days are 1 patient per hour. So I went from seeing 25 patients a day to seeing, maybe 6. 6 is a busy day because you're in the visit for the whole hour. So it's many hours of seeing patients, but it's not a hurried visit. So it feels like we're able to get things accomplished in the visit and then move on to the next person.
Exactly. When Leah joined our practice, she goes, well, when does it get really busy? And I go, this is really busy for us.
Yeah. Yes. And that's challenging because, when I remember what it was like to see patients, 3 or 4 per hour, it was harried because I was spending a lot of time managing the completion of my notes, of my documentation. So the work felt like the documentation, that's not good for me, and it's not good for them either, because what does the documentation do? It gets the bill paid. It doesn't get the patient seen. It doesn't get their problem solved. It doesn't serve any purpose other than to get the bill paid for the organization you work for. And so in this model, I'm spending all of that time face to face seeing the people and coming up with a plan together for how to make sure all their stuff gets done, or we're calling other places in the visit to make arrangements for their care. And I think people feel like they got the whole hour of my full attention.
And to be honest, guys, nobody really reads those notes. When I get notes from other doctors, it's a bunch of cut and paste stuff, and I might glean 2 or 3 sentences out there that are really worthwhile.
Yeah.
We just document what's important. So
Yeah.
our notes are very short, very
short.
concise.
Yeah. And I also think I spend a lot of time in the visit in notes, because many times we spend our time talking about what the specialist had said. So a big priority of the practice is getting the consultation notes from other physicians and reviewing them with patients and talking about what other people said, because again, those 15 minutes or 10 minutes that they spent talking to an expert, they can barely recall what happened. And that's my role too, is to talk about, what was their plan? Do you agree with their plan? Let's make sure that I can help them get their plan done for you, etc.
And a lot of times, if it's a confusing or complicated patient, just the other day, I had a patient seeing a cardiologist down at Cleveland Clinic in Weston. He was referred there for some very specialty work, and he didn't really understand what was going on. And so we did a conference call between myself, the cardiologist, and the patient was in the room with the cardiologist at the time, so it made it a really worthwhile visit. You can't do that in regular practice because you just don't have the time for that.
No.
And it kind of makes it all kind of worthwhile. And it actually does give the patient much better care.
Definitely.
But there are misconceptions about what patients believe concierge medicine is and what other physicians believe concierge medicine is. What do you think some of those misconceptions are?
Well, I think that a lot of patients that don't have any experience with it, they just get hung up on the fanciness factor. We'll have patients look us up online, primary care in my area, and I might come up and they call asking if we take their insurance, which we don't. And, they'll hang up right away, or they'll say, oh, that's not for me because it costs money. And for the occasional patients that actually get started talking about why they're looking for primary care, it's the exact same reasons why everyone's looking for primary care. Either they don't have one, or the person that they have is not meeting their needs. And so I think that the thing to remember is that it does cost money, and we're not used to spending our money on medical care, even though we spend an extraordinary amount of money on medical care. And a lot of times we overspend on medical care because we don't have good primary care. But the fanciness factor is, I think, what is off-putting. And if you remember, I have patients that work retail all the way up, and everybody wants, to me, they all pay the same amount. So that nobody is more special. That's my patient.
Exactly. But we spend more money on coffee.
Right.
If you take the average person who goes to Starbucks or to Dunkin' Donuts, and you add that up every day, the cost of seeing us is about the same.
Right. Exactly. And so I think that, again, the similarity is that it's a lot of times patients who have had a medical crisis at some point in time, or maybe their family model was always that they had a really good personal primary care, and maybe it's not a concierge doctor before, it was an old-fashioned doctor, which there's very few of those around who own their own practice, but they just have a requirement that they know who their doctor is, and that that person knows who they are, and that, their care is important, not just, mandatory.
I agree with all that from a patient's perspective. What about from a physician's perspective?
So I think more and more these days, other physicians, especially obviously the ones that we choose to work with, are the ones who absolutely know what we do and very much value what we do, because if we do our jobs well, it makes their job so much easier. They're able to just do their specialty instead of, ordering medications that they may not be familiar with because this patient can't get in to see their primary care doctor. So I think that as time goes on, the other physicians who work with us and people like us know that this is not about fancy, this is about good care, and they're appreciative of it. And I actually take a lot of patients these days because I would say that a majority of patients asks at least 3 sources before calling me with intention to join. And one of the people that they typically ask is another doctor that they respect, their cardiologist, their gastroenterologist, whomever. And when they mention that they're planning to join a practice like mine, they are told that's a great idea because of, making sure that their primary care needs are going to be met.
Yeah. And I think looking ahead, do you think concierge medicine is a niche model, or do you see it expanding as more doctors and patients seek that personalized care?
I see it expanding for several reasons. I would like to think that it's expanding only because it's what patients want and because they know that this is how they're going to get the best care. But I also think it is going to expand because the current model is not going to work long term.
broken.
It's very broken, exactly. And I think that, our job hasn't looked like it was supposed to for decades. Primary care hasn't been able to do a good job across the board nationwide for patients in a long, long time. So I think that assuming that payers and legislation understands that the fix to a lot of problems is very good primary care, it might get fixed, but it hasn't gone that way so far. So I think that we should see changes in the future for primary care across the board. And as long as there's doctors who still choose this field, it's going to look like this.
So, myself, Dr. Ira Pearlstine, Leah Ginn, and Dr. Leighan Talton, changing the landscape of medicine. Because I think if we wait for the government to do it, it's going to be very long coming. Thank you so much for being on the show this morning. This has been
Thank
great.
you.
Want to come back and do another episode with us?
Absolutely.
We'd love to have you back.
Absolutely.
Thank you for watching another episode of Preserve Health Talks.